We'll call the meeting to order. And can I get a motion for the agenda?
I move we approve the agenda.
Second? Go ahead. Sorry.
Any discussion? All those in favor?
Aye.
Okay, can I get a motion for the minutes of September 24th?
I'll move that we approve the minutes of the September 24th meeting.
I'll second that.
Any discussion? All those in favor?
Aye.
Okay, health officers report.
So he just emailed me last night. Pretty short.
That's not a minute, am
You have one?
He was actually with us at Wasac last week and got really involved and had a good time and
Represented as well.
yeah, I think so. So he's on top of it. So we did meet last week and talked about the Health Coalition and establishing our health department as the backbone. So Peggy and Eric and I will need to talk about Mason Matters. So I'll set that up. Peggy will find time where the three of us, and then probably just the treasurer need to sit down. Go over that. He's working on the MAT program in the jail. So we had a meeting on that this last week as well. It was well attended. We had people from north end of the county as well as south end, and everybody shared what they were doing in the jail. And there's more people doing stuff in the jail than you'd think. It's really quite a busy place. And some of the things we talked about was when people are released from jail, not releasing them in the middle of the night necessarily. And we talked about the policy, how that policy was, and basically it's on hour for hour. If they're there for 7 days, 7 days is X number of hours. They're released on the hour that they were their intake occurred. So Thurston, for example, has set hours of discharge, one set in the morning, one set in the evening. And one of the reasons we've talked about that is for those folks that have substance abuse problems is to, catch them at the door and start getting them into service right away. So that's one of the things that Dan was working on especially. And then he was talking a lot about the Hep C program, and the governor has given us a directive in public health to address Hep C and no funding to do it. So Dan is getting creative on how he can do that. It's kind of administratively and work with the hospital, work with our partners at how we have access and see what we can do there. What he and I have talked about is how do you get upstream and prevent it in the first place? Well, a lot of what we're seeing are people who acquired Hep C back in the 60s and 70s, and it's just now becoming an acute Hep C. It's treatable. I mean, the cost for treatment has dropped dramatically. It was, I think, initially $75,000, wasn't Peggy?
At least that. Yeah.
And it's dropped dramatically, and Medicaid is picking that up as well. So treatment for Hep C, to cure it, was cheaper than trying to treat people in the hospital with it later. So I think that has been addressed.
And the cancer that goes with it.
Right. Yeah, liver failure and all those
Yeah.
other things. So that's what he's been working on, and he's been pretty busy with that. He's also talking with the other health officers. Dr. Rachel Woods is retiring in Thurston County, so she'll just be working Lewis County. Like 1 day a week, much the same way that Dan works for us. Thurston County is recruiting a health officer, and he said no.
Yay.
So I was very tickled with that. He's like, I like being in private practice and doing my health officer gig too. So yay, Dan. Anyway, we had a good time at the conference. He learned a lot. We kind of went in our separate ways, and between Dr. Stein and myself and the two commissioners, we had a lot of different things during the Wasac conference. So, morning. I think that's it for him.
Okay. I realized I really didn't go around the table and do introductions, which is probably probably a good thing to do. So I will start with me. I'm Peggy Van Busker. I represent House Bill District 2.
I'm Yuri Plus, I represent the County Fire Commissioners Association.
Kevin Schutte, Mason County District 2.
Dave Wyndham, Administrator.
Sharon Trask, Mason County District 3.
Randy Nolan, District 1.
Oh, Allison Smallwood, Public Health.
Ben Johnson, Public Health.
Amy Davis.
Tom Davis, Veteran Advocate.
Okay, thank you.
Merry Christmas, guys.
So we'll go to administration report.
Okay, and you had the report in your packets. Anything to add? I'll just kind of pick up from the Wasatch Conference. So we did have Wasatch at the Wasatch Conference. That's the one time that we get to do the conference in conjunction with our county commissioners, so that was well attended. We had a lot of programming, not only for us, but for the commissioners as well. So what are the duties and responsibilities of the Board of Health? So some really foundational things for commissioners to learn about. Opioid response, homelessness response, all those programs that public health is really starting to address, trying to go upstream. And it was well attended. We had over 400 people there altogether. Wasatha was the second largest group behind the county commissioners, so we had a good showing there. The health officers were very active. We went through our legislative agenda. This year we're going to scale back. So, and this kind of flows into the budget discussion. But last year we were allocated $22 million from the legislature. Only 18.3 million arrived. So we're going to go back for a technical fix in the budget to try to pick up that extra money, and I'll come back to that in the budget discussion. Let's see. We've got SmartGov starting a soft start next week. That's our permitting process we're going to be doing online. So well construction permits for the health department will be done online as of next week. People will be able to do those from home. Okay, and I think that's going to be about it. Everything else basically is in the administration report. So if you have any questions.
I don't. And I'm assuming someone's here for Lydia, since I don't see Lydia.
We're here for the debate.
Oh,
Yeah, Lydia, just her report stands.
yeah, okay. And hopefully no questions on her report.
And Alex did call in this morning. He's ill. So Environmental Health has hired a replacement in the water program. So we've got a new person there, just getting rolling in the water program. So we're kind of coming back up to strength there. So Alex is in the process. This is, I think, his 6th person to train this year.
Yeah.
So I did talk to the administrator over at Thurston and asked her to quit snitching our people. So her comment was, she gets them from us and they're very well trained.
And I noticed he mentioned the SmartGov
Yeah.
in his report also.
Yeah.
And I was talking to Ben earlier, and I just wanted to mention that he is having, you want to talk about that at all, Ben?
Oh,
On
sure.
the-
Yeah, I'd love to. Do I need to come up?
Sure.
Sure. So as some of you may or may not know, we have 2 substance abuse prevention coalitions, one in Shelton and one in North Mason. And the Shelton Coalition held a prevention summit about 2 months ago out at the Squaxin Community Kitchen. The North Mason group decided to do a series of summits, and it's going to be 3 evenings. In the report it says January, February, March, but the coalition chose February, March, and April. I do have the dates, but I don't have them right now, and I'll make sure to get that published and get that out. Of course, we're going to be doing big promotions, especially up in the North Mason area. The goal is to get mostly community, hopefully professionals come too. It's going to be in the evening. They'll be starting at 6 o'clock. It'll go about an hour and 15 minutes or so. The topics are going to be vaping issues, and we hope to have the Lung Association actually do that training. Allison and I attended a vaping training, a 3-hour vaping training last week with them, and they were excellent. So we thought we'd invite him right there on the spot to be that group. Jason Kilmer, who does some marijuana, substance abuse issues. He's very dynamic. He has agreed. We'll hear which night he's going to choose next after December 4th. He's out of the country actually. And the last one is a social norms evening. And if you don't know anything about social norms, basically it's kind of like re-messaging the positives instead of the negatives. So if 20% of our students or population smokes, well, 80% doesn't. So we want to talk a little bit more about the positive piece and get those messages out. We still, because what happens is we go to these community events and parents are saying, parents and students are saying, everybody does it, all my friends do it. And the reality is that's not always true. I mean, we do have high vape rates in our community, but the whole state does. Same thing with marijuana and alcohol and other drugs. But we want to try to change that messaging. And so one of those nights, person's his name is Scott Waller. We haven't got a definitive yes from him yet, but he's the person we want to have come out and do that training. So we'll get you the dates for those 3 nights, and hopefully, all you guys could come. It'd be nice, at least for one of the nights. I think it might, or maybe we can split the commissioners and come pick a night, come say a few words at the beginning. That would be pretty cool. So.
Thanks, Ben.
All right.
So, the next on our agenda is the vaping ordinance update.
So I've been talking about that. So, for those of you who don't know, we are working to get vaping banned on all county property to include parks and fairgrounds. So we will be briefing that, I believe it's been briefed, but we're gonna vote on it on December 10th. And there'll be a public hearing that morning at 9:15 a.m. to hear comments from the community about that. Yeah, so we're starting with county property, and we're hoping to expand beyond that. We wanted to get this started first, so.
Fairground one's gonna be easy. It's done.
Yeah.
We don't have fairgrounds anymore.
Right.
so-
Yeah, right.
Yeah.
And as a reminder, Tobacco 21 starts January 1st.
Correct.
So that includes vaping as well.
There are a lot of issues with vaping that, we as a county and the state are really dealing with right now. And it's the indoor vaping. We have a few shops in our community. I just drove by one last night where, people are allowed to come in and sit and vape all day long if they want.
Vape indoors.
Indoors, yeah.
So that'll be probably our next
Yeah.
focus, because it's really concerning.
There's some new data coming out on secondhand vape and what's actually in vapes. So that's one of the reasons we're trying to get some more community education out there and get educated ourselves.
Right. So just kind of along those lines, I know of 4 vape bills that are probably going to hit the legislature January, 6th is their first day?
Yeah.
So those will probably preempt anything we want to do locally, so
Yeah.
that's fine.
That's great.
And I guess it was the vitamin E
Mm-hmm.
Yeah, vitamin E acetate.
acetate, yeah.
Yeah, was identified, so that's been taken off the shelves. But something we identified in our training the other day, which was really interesting, is we have a lot of tribal retailers that are exempt from any of these ordinance or any of the laws that come down. So it's still very available in our community for that reason.
Yeah.
So.
Yeah, there's all kinds of things happening with vapes, with promotions, getting the flavored vapes to young people still. And one of the fears is that they're still going to be able to get it online, or they're getting it online, or people are making it at home, in the garage, or that sort of thing. So that's going to be a little bit more difficult to enforce in the future, but at least some of the laws are getting handed down.
How easy is it for them to make it? I was curious about that. I don't know. I've never seen anybody.
Actually, I've never actually seen anybody make it either, but I'm not sure how easy it is. Do you have any information?
And I mean, just from our training the other day, you can order all the ingredients on Amazon and have them shipped to your door, and you just.
It's a mixture of glycerin and flavors.
Yeah, my understanding is that there's all kinds of recipes online that people can follow, and kind of like making Molotov cocktail. If you want to find it, you can, and people will. So
maybe education is one of our better.
Mhm.
yes,
Yeah.
yeah.
And and they're selling on black market basically because they just put it in these little vials and they put a little, they name it, their fancy names, and they sell it basically on the streets. That's going to be a very difficult thing
To counteract.
yeah.
So education about the dangers
I think
Yeah.
it's,
What
and
you're
the fact
doing.
that we don't know. We
Yeah.
we really don't know the long-term health effects, and we're beginning to see them with the outbreak of the severe lung illness. But as far as long-term, we just don't know, and that's what's scary.
You don't hear a lot about the secondhand.
No, you don't.
No, you don't.
There's just not enough research either
Yeah.
on secondhand. People are getting ill. People are dying across the country. And so when that happens, we're hearing about that fairly, quickly. But the secondhand, what we are getting now is a lot more information on what's in it.
Yeah.
So,
And that research is being done. I attended a conference last year related to vaping, and they are doing secondhand vaping studies, but they're currently in animal models, so they're still in like mice models. So it takes a while to scale that up to human research clinical trials. So it may be several years before we hear anything definitive.
Yeah.
Yeah, so that's all we have. Thank you.
okay,
Thanks.
thank you. So we're to the budget.
Always our favorite. So this kind of rolls into the discussion we just had, and a lot of what we have hitched our wagon to in public health is the vaping tax. So it already came in short from what was projected, and that's where our deficiency from 18.3 to 22 million came from. And we were going back for a fix, and now of course there's ban on certain flavors, and that's going to further reduce the revenue. So yeah, at a large level, we were looking to go back to the legislature for money for Hep C and for immunizations. And at our meeting last week, I just basically had to break the news with the vaping tax revenues dropping. The legislature feels really that they have addressed immunizations in the last session. They wrote a bill, they funded it. In many ways, they think it's off the table. And Hep C is just not something people are outside marching up down with Hep C signs. They're talking about homelessness and poverty and housing. And I think that's where the legislature will probably spend most of its time. They're not going to be looking at public health to provide us with any large influx of money. So when it comes down to our local budget, we're pretty flat from last year. We're actually down about 18,000, and that's in some grant funding that has changed as far as revenue goes. So we've adjusted, of course, expenses to match, and really everything's pretty flat. The Foundation of Public Health Systems money, which we get, is $42,000. If we come up to the 22 million across the state, we'll get an extra 58,000, so that'll move us from 42,000 to 100,000. So we're part of a group of about 20 smaller and medium-sized health jurisdictions that get just a base funding of 100,000, and then those with larger populations will get an additional per cap that goes on top of that, with Seattle getting probably around $6 million because of the size of the agency. $100,000 is $100,000, and I'm
Yeah.
not going to complain about it. But I'm not going to put it in the budget till I see it.
Mhm.
So after the session, if it does get the technical fix done, which I would be tickled, we'll see that extra money come in, and that's already kind of earmarked into environmental health. We're looking at other ways to address community health issues, especially around chronic disease. We're not really doing anything for chronic disease. And I did talk to Lori Jenkins, who is the incoming Speaker of the House, about chronic disease and how It's not sexy, and the legislature hasn't done anything with it for 10 years. 10 years ago, they did a program called Healthy Communities, and they funded it for 2 years. They were going to fund it for 3, and then they yanked the funding the last year, and that program kind of collapsed under its own weight. So that one's gone. I'd like to see something like that come back so we can start addressing diabetes and obesity. So we are going to have a little bit of a push on that, but really it's to set up for 2021, the next long legislative session, and just to go back, just do the groundwork now, get in their minds, talk to them over the interim, and come back and make the ask next year. So locally, like I said, we're basically flat. Alex and I will be coming back with a proposal to look at how to fund clean water work. So Alex has got that just about wrapped up. So at January meeting, we should be able to do a presentation on that.
Great.
So that's our other big concern, is just water work. And then you're going to go talk about estuary programs, right? So one of the problems we had was even though we went to, I went back to DC and we got more money into the National Estuary Program, Mason County didn't see any of the money, the extra money. So
And why was that?
it was allocated to other higher priority
Estuaries.
estuaries. Yeah. So that's just kind of the way that one works.
Yeah.
So funding with building, I'm seeing building probably staying flat in comparison to this year. I'm not seeing a downturn probably. OFM says flat to maybe slightly down, but I think we'll probably stay pretty flat on building, which affects our wells, well construction, on-site septic fees. I don't see 976 having any impact on us at all. That's just not something a fund that we tapped into. In 2004, it affected us a lot. We had millions that came out of the first set of tabs that was reduced back in, I think, 2004, the first initiative that went to $30 tabs. So public health has struggled to come back from that, and never really has come back from that, because they came in 2009 and swept all the cigarette taxes away and into general funds. So public health has kind of been on the back burner for a while. So our budget, though, is stable, and the employees are stable, and I think we're looking okay for this coming year.
Good.
So I'm not, if Thurston can keep their staffing under control, we'll be fine.
Quit stealing our
Quit
employees.
stealing our employees. But I think we're set into this coming year. I'm feeling pretty good about it. So.
Okay. So, any other board business discussion?
Sorry,
Go
go
ahead.
ahead, Gary. Nope.
What's the pay scale in Thurston compared to Mason?
So their entry level is above our entry level by quite a little bit. Once you get into upper parts, it's about the same. But when we have new people coming in as environmental health specialist 1, they can jump over there and make $7,000 or more. For nurses, it's about $20,000 for a nurse to go elsewhere. So for nurses, it's pretty healthy. Now, none of our nurses have left. Our nurses have been here, like been here a long time, very dedicated to the community. So
This is pretty much entry-level environmental health.
we have the same problem with building. Somebody will come here and they get their certifications, and then Pierce or Thurston will snatch them up as a building inspector, because they can make a lot more
A
money.
lot more.
So it's just kind of one of the, and that's been the same way in Okanagan or Stevens or Ferry Pond, or wherever I've worked. The larger counties with the larger money tend to draw. We tend to be a training ground for the new employees. So.
Kevin?
Yeah, a couple of quick items. So as Dave mentioned, in December, I'll get to do two of my favorite things. One is meet with the EPA and get to do it in Seattle. So that'll be a fun trip. Talking about funding and programming, and that's is part of my role as representing the county on the Alliance for a Healthy South Sound. And so it's part of their the EPA's effort to reach out to local integrating organizations that spend the money that gets passed down through both the EPA and the Puget Sound Partnership. So I'll definitely bring back whatever information I gather from that meeting, and hopefully it'll be positive, and there are some things that we can work toward. The other item is, as was mentioned earlier, we attended the Association of Counties meetings last year. Dave and I had a quick chat about this last week in Spokane and talked to the county commission about it yesterday, but I attended a meeting with the Washington State University Medical School in Spokane, and they have a mobile outreach program that they do to get their medical students working in rural and underserved communities. Currently, that program is funded through their foundation, through a benefactor, and they have the capacity to expand that program from not just the east side, but over here to the west side as well. And so as they gear up for that, I've been talking to Dave and the commission about finding a way for us to get in a partnership with Washington State so that they could bring some of those services here to Mason County. And I think it would be beneficial for a couple of reasons. One, it's a good opportunity to get services into the more rural parts of our county. We know we have a mobile medical outreach done through Peninsula Community Health. This could be supplemental to that, or a partnership with Peninsula, as well as working with the public hospital districts 1 and 2 in the county. The other thing that I think it would be really beneficial for us is rural counties, and this is why there's so much loan forgiveness and money being put into rural provider education. It takes us about a year to recruit a provider to Mason County, and it's not just us, it's rural communities like ours across the country as well. But I think by having an opportunity to bring medical students into the community to see the quality of life and see how they can, how they can serve a community like ours, might be helpful in turning the corner on, reducing that lag time in provider recruitment. I'd like to see us engage with Wazoo on that. I know, just from my own personal experience with my wife's program at Wazoo for their doctorate of nursing practice that she's going through, there are opportunities for partnership there too, and in a lot of ways nurse practitioners are filling those voids, but that doesn't remove our need to have doctors coming into the community as well, and get them while they're young and impressionable and doing work in the community, and hopefully they'll see this as a great place to not only work but also live and contribute more to our community. So more information to come on that. That should be coming online at some point in 2020. So we'll be tracking that.
Excellent. We always need more providers. Okay, anything else? Public comment. Go ahead, Tom.
Thank you. My name is Tom Davis. Just a couple of things on the vaping ban. I said it before, I'll say it again. I certainly appreciate this committee's efforts to initiate a vaping ban on county property. I think it's a strong step in the right direction. Even if it's not as effective as we'd like, it sends the message that we're all on the same page legislatively, hopefully from the legislative body at Olympia all the way down here. It's going to come up for a decision on December 10th. I have to ask my wife if I'm going to be in town on December 10th. Right now, it doesn't look that way, but for what it's worth, you know how I feel about this. We have enough problems without creating more problems through technology that makes an end run around the old-fashioned type of smoking, and the fact that we've taken the lead, even though legislatively there are certain bills coming up, shows that we're looking at this more progressively for the future. So I appreciate that, and I'll be speaking in that legislative session as these bills come up. The other thing that I hadn't planned on speaking about was MAT. My experience in the jail, talking with people who have been hurt, either in active duty or not. Sometimes I'm talking to them, they're laying on the floor because they say it hurts too much to get up. A lot of these folks, some of these folks get on narcotics because of the pain. Now the VA used to administer them by the scoopful, and then of course now the pendulum swung the other way. Even when you need them, they're difficult to get. How the jail handles that and dovetails with it according to their MAT program would be of great interest to me, because it's very difficult to talk to somebody about the future when all they can think about is how much they hurt. Now, we always seem to focus on maybe the one person who's scamming the system. There's always going to be people who scam the system, but there are actually much more legitimate cases of people with injuries that they can't get some sort of treatment for. Normally, what happens is they oddly enough, they switch to methamphetamines. I don't know if that's supposed to help, but they do. Anything that distracts from the pain, whether it's a high or a low, I guess, is better than the pain itself. So I'd love to hear a conversation of how the jail intends to administer those things, so they could make more rational decisions for their future. Kind of like they're getting into vet court or getting into drug programs and that kind of thing. Because right now they don't, like I said, they're not open to those kind of discussions when they're in pain. Thank you.
Thank you.
Madam Chair, maybe we can invite the chief over here for
I think that'd be great.
Yeah, I think that'd be great.
I know that at the federal level, they've introduced legislation that would put Medicaid on pause if someone is in jail for 30 days or less, where right now they discontinue it and they have to re-enroll. And if they go to a pause, then the minute they're let out of jail, the Medicaid kicks back in and they can start services again. So that's always been a gap. And if you can't get somebody into service right away, you may lose them again.
Mm-hmm.
So it's trying to get addressed.
Well, that's a critical piece of reentry too.
Mhm.
You come out and you have nothing, and just the ability to at least have, coverage,
Yeah.
to continue treatment.
To be in the program.
Yeah.
especially in the middle of the night.
Yeah, that's one of the things Dr. Stein's working on is how can we meet somebody at the door of the jail and
And get them in a program.
start that integration the minute they come out the door. So,
What's state institution doing about that?
I don't know. I can follow up on that though. I know that we did have a meeting on it last week about what to do with Washington State or Western Washington, and the governor's plan is to put the effort into community 16 to 32 bed facilities, and start decentralizing that out of the system. So it'd be interesting to see how that's going to fund it too.
Okay.
So I think we'll be funding that ourselves probably.
Any other comments?
I'll
Okay.
just make one quick comment too for looking ahead to 2020. I think as the BHO facility comes online, hopefully here in the next couple of weeks, it might be good to invite them in for a conversation in January as well.
Good idea.
So that they can give us an update on.
That'd
Okay.
be great.
And I think maybe we should add to that the MCOs,
Yeah.
the managed care organizations,
Right.
because they're charged with funding what we're doing, and I have not seen a concrete plan of what that looks like. So, and the commission has voted to extend contracts to the people that we're working with now for another 6 months, just to get them through that.
That initial.
Transition time.
Yeah.
And I think
Yeah,
we should have
that'd be
both of
great.
those. Because I would like to see if the MCOs are truly going to fund things and that piece is taken care of, maybe our treatment sales tax can be used locally in a different way. I don't know. It's just something we need to explore.
Right.
The other thing on that, along those lines too, in conversations that I had last week with other counties who have already gone through the transition, there are a lot of things that we could be asking the MCOs to provide for the community as well. I know that AmeriGroup up in Island County funds a public health nurse, to do outreach and some of the work that Dave has been talking about. And so I think as a Board of Health coming into 2020, I'd like to see more of a focus on starting to think about how we really do move the needle on these issues in the community and being creative with our asks to the MCOs, because it is somewhat of a disruption to how services have been provided traditionally here. And so that isn't necessarily a bad thing in the sense that it might give us an opportunity to look for some new opportunities to bring into the community and from a service and a funding perspective. So something I think that this board should be thinking about as we head into 2020 and the transition.
Well, maybe even invite the jail in at that point too. So
Block out your first January meeting in
It's gonna
2020.
be a busy one, yeah. Okay. I think
And you'll-
that's a great way to start off 2020 though, is to have
Yeah.
a vision on what we're gonna work on
Mhm.
and then move forward. So what I'm getting from the board is Matt, jail services, medical outreach is kind of a focus for this coming year. So I'm putting together work plans right now, so this really dovetails nicely into what I'm trying to write. so.
Great. Other comments? Okay, do I have a motion to adjourn?
So moved.
Second.
Okay, all those in favor?
Aye.
Okay, cool.